Hi everyone, my name is Eva Zohuis and today I'm joined by Jessica Brennan. She's a pediatric nurse practitioner at UCSF Benioff Children's Hospital in San Francisco, USA, and we're going to talk about her role in kidney care. Thank you, Jessica, for joining me for this podcast for the RPSG Education Biobank.
Thank you. It's my pleasure to be here. Thanks for the invitation.
Let's start with the first question. Please tell us, who are you and what is your background?
Sure. So as Eva mentioned, I'm a pediatric nurse practitioner. I work in the kidney transplant program in San Francisco, California at our large university hospital, UCSF. My background, I received my Bachelor's of Science in Nursing in Montana, which is a very rural community. I worked for about 5 years in a variety of pediatric settings, from critical care to psych to medical surgical. And then I moved down to California and I worked down here as well, and then went back to graduate school to obtain a master's of science in nursing, which allowed me to be a pediatric nurse practitioner. I also completed a minor in education. Initially, I was hired by UCSF to work in a research role. I worked alongside of a team running clinical trials just for about a year, and then transitioned to a clinical position. And next month, I'll be celebrating my 20-year anniversary in transplant, which is crazy.
Wow, that's exciting. So what does your main job entail?
So my main role is as a clinician. My primary clinical duties are to manage post-transplant patients, so pediatric post-transplant patients, anywhere from babies to age 22. I work clinically doing that about 2 to 3 times a week, along with pediatric nephrologists, social workers, dietitians. We have a child psychologist, and then, of course, our surgeons. The other part of my role is to evaluate new patients for transplant and prepare them for both living or deceased donor transplant.
So what is your role in kidney care?
So primarily as a clinician, that's what I spend most of my time doing. I also work as an educator. I'm an associate professor in the School of Nursing here in San Francisco, and that allows me to lecture on topics around kidney disease, kidney care, and transplant. And then in addition to that, I'm a clinical preceptor for master's level nursing students.
Wow, so that's quite a lot.
Yes, it's busy. It's a busy job, but always something new, which is why many of us like transplant. There's always breakthroughs and very interesting things going on all the time.
What is the latest research in your field?
There's, lots of research in transplant all the time. I'll just speak maybe a little bit of my research. So I have a couple different research interests. One of them is around the impact of immigration status in transplant. My team, my co-authors and I published a article in American Journal of Transplant this year, looking at some of the long-term outcomes of immigration status on pediatric kidney transplant patients. And that's something I'm passionate about, and have done a couple different research projects around that, and particularly of interest now in the United States with a lot of policy change. One of my other interests is around infectious disease. I will be presenting, along with my medical director, some of our research around the use of IVIG in an opportunistic infection called polyoma BK virus. So we've tried some different things around this virus and caring for kids, and we'll be presenting some of our data at the International Pediatric Transplant meeting in a few months.
So you've already run a few trials with that one?
Yeah, so we've done trials. All data in pediatric kidney transplant are very low numbers. So we have just 12 kids in our study, but certainly important for these small numbers and, rare infections to report on them. So being able to present at national or international meetings, I think, is really important, and especially shows the role of nurse practitioners in research and participating, in teams like this.
Great, thank you. What advances do you think will be there in kidney care in the next 5 years?
It's a great question. I have parents ask me that all the time. I'm really interested in this idea of xenotransplant. We're not currently doing that at my center, but I was sort of taking in and reading in these trials. So if that could come to the forefront, and using animals for potential transplant donors, I think is sort of fascinating, and I'd love to see that make it to prime time. Our center has done some work on the bioengineered kidney, which is also fascinating. Finding things to put us out of business in transplant are really interesting, and having patients not need immune suppression. I think that's probably, it's not a project I'm personally working on, but I think that's probably at least 5 to 10 years out where we could really develop an artificial kidney, but certainly things that are interesting to read on and observe.
Yeah, it sounds promising. What advances would you like to see in kidney care?
This is maybe a small one, but something I'd love to see from the pharmaceutical industry. Everyone that has to take medicines every day, multiple times a day, there's a struggle, particularly a struggle with adolescents who I take care of, quite a bit. So working to find medicines that are easier to take and can be taken once a day as opposed to 2 to 3 times a day, I think would be something I'd love to see for all patients, specifically for our adolescents who struggle with, trying to have a life and a job and go to school, and taking medicines multiple times a day is a real challenge. They have been able to do that with tacrolimus. There's a version now called Envarsus that we're using that only needs to be taken once a day, and we've had some great success improving compliance with that medicine. So I'd love to have that option with, many of the medicines that we prescribe in transplant. On the bigger scale, I'd love to see sort of more equity in transplant, both from like the geographic perspective. In the United States, is a very large area, and our transplant times are quite different. Where I live in Northern California is highly populated, so our adults are waiting, sometimes 8 to 9 years for a transplant. Other areas of the country have transplant waits of 3 years. So there's a lot of disparity around geography, and then we still have a lot of ethnic disparities or inequalities in our transplant rates and listing and things that I'd love sort of on the global scale or national scale to see advances.
Jessica, thank you for your time. It was very fascinating to hear about your role in kidney care. And thank you, dear listener, for joining us for this interview. We hope this conversation was insightful into the world of kidney care, and stay tuned for more interviews with other professionals involved in kidney research. See you in the next episode.